Hello, again, my name is Esmeralda Paez, and I worked on this project with Dr. Trisha Self. Our project focuses on caregivers' perceptions of interprofessional services for children with developmental delays in an educational setting. The program here at WSU is called Interprofessional Structured Learning Program, or iSLP. A child with developmental delays developmental needs may have delays in areas such as speech-language cognition, sensory integration, and gross and fine motor, which requires multiple disciplines to assist the child with their needs. They may see a speech-language pathologist one day and a physical therapist the next. In an interprofessional setting, the child has all service providers in one place to provide the child with the best possible outcome. Interprofessional Education, or IPE, is the foundation of iSLP. IPE involves a structured, pre-arranged learning experiences for pre-professional students to learn with, from, and about each other from multiple disciplines. Students who engage in IPE learn who they are as professional and many other things. IPE ensures patient safety and quality outcomes. In an interprofessional setting, service providers share their knowledge, they plan treatment together, and tackle the issue as a team. The iSLP team here at WSU includes physical therapy, occupational therapy, early childhood unified, speech-language pathology, family, and special education music. There are two main purposes of iSLP here at WSU. The first is to provide children with communication, social, and structured learning needs with the best possible opportunity to function at the highest possible level. In previous literature, parents have reported positive experiences with IPE. In an interprofessional team, parents are included and gain trust from the professionals. In this type of environment, goals are achieved and families respond favorably to the positive changes seen in their child's development. The second purpose is to provide pre-professional students studying to be a speech-language pathologist or interested in being in the early childhood united field with authentic field-based learning experiences. Pre-professional students who engage in IPE, they learn, they appreciate other viewpoints from different disciplines and learn how to communicate effectively as a team. With the experience gained, they may carry this out into the workplace. The significance of the study is to publish the process and the results. There tends to be so that other institutions may adopt this model and eventually expand. There tends to be lack of IPE opportunities for family to take advantage of. With the resources that are available to the families, there are usually long wait lists. So therefore, there continues to be limited opportunities for these families. Research has shown that this model is effective. The purpose of the iSLP here at WSU is to obtain parents' perceptions and to contribute to the academic literature. This study consisted of 4 participants who were all mothers of children who participated and completed 2 academic semesters of iSLP. They all agreed to follow up with the director for any evaluation purposes. Data was collected via face-to-face interview at the parent residence by myself and a graduate student. The interviews lasted about 30 to 45 minutes each, and the interview's audio was transcribed independently by myself and 2 graduate students. Any miscalculations were discussed among us and Dr. Self until we became in agreement of at least 90% or above. To obtain information about the parents' perspectives, feelings, and experiences about the program, the following questions were asked. With these questions, we were able to obtain the parents' experiences about their feelings about interacting with professionals from multiple disciplines, their overall satisfaction with the process, and any suggestions they may have to improve the program for future families. Transcriptions were analyzed and coded by grouping recurring words and phrases. Initially, 45 codes emerged. Key themes were combined, which led to 13 themes. Those 13 themes narrowed down to 7. The 7 themes include the interprofessional nature, structure and consistency, outcomes and skills gained, family tools, child's future, transitioning into a pre-K 3 to 5-year-old program, and how iSLP positively impacted the family. Out of the 7 themes mentioned, I'm going to focus on the following 4. Mothers appreciated the structure of the program, the consistency of the daily activities, the interprofessional nature of working with multiple disciplines, and being able to ask questions, as well as being involved in their child's treatment. One mother mentioned that she believed having an occupational therapist and a physical therapist there was extremely important for her. She was not aware of her child's sensory needs, and she learned a lot from the occupational therapist. Mothers discussed the improvement in their child's communication needs, the increase in vocabulary, how their child were able to voice their wants and needs, the increase of social skills, and their child being able to interact with others. One mother said that a big outcome from the program was that her child was able to voice and tell her what she wanted and needed, and that she didn't have to guess so much anymore. Mothers indicated a positive impact on their child's future. They saw their child with new perspective and had no concerns about their child's overall well-being. Their child are now able to engage in daily activities and transition smoothly into a 3 to 5-year-old preschool program. The parents gained confidence that their child would be able to grow up as a typical developing child. One mother shared that the future she saw for her child was like any other typically developing child, and she was thrilled that her child no longer needed therapy services, and that was just incredible for her. Mothers reported that they had gained knowledge and skills from the sessions that they attended with their child. They implement those strategies and activities at home and have seen an increase of communication interactions. One mother shared that she has now a bit of a speech-language pathologist perspective and now talks with her developing children in a more descriptive manner and saying things like, "Where are your pink shoes? Oh, there's a pink flower in your shoe," and things of that nature. All mothers shared positive feedback about the program, and the comments supported areas such as the interprofessional nature, being able to converse with professionals and asking questions, and the overall structure of the classroom. With this type of intervention services creates a safe and productive environment for the children and the family. In this study, there were a limited number of participants. Additional data should be collected from families that complete iSLP in the future to identify additional themes. Overall, parents reported positive outcomes for their children themselves and their families. Parents' feedback supports the interprofessional model is effective. Thank you. Do you have any questions?
So how would you modify this if you had to look at it the second time around?
Well, probably have less children, because right now there were 4 children, although we do need more children to identify additional themes, but I believe it works better when you have less children. That way you can focus on the children